The heart is a vital organ. Its primary function is to pump blood throughout the body. The heart ensures the delivery of oxygen and nutrients to tissues and organs while removing waste products like carbon dioxide. The heart is responsible for pumping blood throughout the circulatory system. Hence, if the heart is failing, then there is trouble. Maintaining a healthy heart is essential for overall well-being. And being aware of these early indicators, of which will be pointed out in this video, you can quickly take the necessary steps to prevent further complications. Again, we will explore some foods and habits you should avoid and those you should consider to have a happy heart. Warning signs of heart failure. 1. Shortness of breath. One of the most common signs of heart failure is shortness of breath. It might feel your chest is tight and you are working harder to breathe. Note that shortness of breath that also be a sign of asthma. This symptom may occur during a physical activity or when you lie down. 2. Abnormal heartbeat. Your heart working harder to pump blood will let your heart beat faster than normal. Your heart will start racing and sound out of the rhythm. 3. Buildup of excess fluid in the body tissues. This symptom is usually indicated by swollen feet, ankles, legs or abdomen and weight gain. The blood's inability to pump blood will cause the blood to be unable to flow in the veins, causing it to build up in the tissues. Sodium and water won't be able to be disposed of by the kidney, hence causing fluid retention in the body. 4. Fatigue. Whenever you have heart problems, you begin to feel unusually tired or weak. This happens because the heart is unable to pump enough blood to meet the body's energy needs. You tend to have difficulty with having everyday normal activities like walking, climbing stairs or carrying lightweight items like groceries. You may also experience dizziness and won't be able to do some simple exercises. 5. Confusion or impaired thinking. The brain needs blood to be able to function. Having heart problems would make the brain unable to receive sufficient blood pumped by the heart. You tend to have loss of memory, consistent confusion and difficulty in concentrating. The change in levels of certain substances in the blood to help the brain function properly, such as sodium, can cause confusion. 6. Persistent cough or wheezing. A sign of fluid buildup in the lungs due to heart failure is persistent cough or wheezing, especially when accompanied by white or pink mucus. The coughing is often worse at night or when lying down. 7. Pain, numbness and tingling. The heart's nerves are connected to other areas of the body like the neck, back, arms and feet. Heart failure will cause pain and discomfort in the chest. This will then cause numbness and tingling sensation to radiate from the chest to these areas connected to the chest. It's best to seek immediate medical attention if you notice any of these symptoms in your body. Note that these symptoms may not always be related to heart failure but may be related to other health problems like asthma or allergies. If you have these symptoms, make sure you get diagnosed to be sure of the exact health problem you are facing so it can be handled appropriately and quickly before it gets worse. Heart failure may be caused by a number of risk factors. Old age is a factor of heart disease. In most cases, people who are at the ages of 50 and above tend to have health problems, and this renders their heart not to function as it should be. The use of tobacco, cocaine or alcoholic products. Most of these products contain powerful stimulants which constricts blood vessels and increases blood pressure. Continuous consumption of these products may increase the risk of heart diseases and stroke. The food we eat also affects our heart health. Consumption of too much salt and fat increases the risk of heart failure. These include foods containing high saturated and trans fats like fast foods, processed foods, and high-fat dairy products. It's important to limit your intake of these foods and opt for healthier options like fruits and vegetables, whole grains, lean proteins, low-fat dairy products, and drink enough water. There may also be cases where people develop heart failure because there is family history of congestive heart failure. Being overweight puts pressure on your heart. Being obese makes it difficult for the heart to transport blood through the veins to other parts of the body. This will cause the blood to build up in the tissues and performance of the heart will begin to break down. Health problems like diabetes and coronary artery disease increases the risk of heart failure. This usually makes your arteries become narrow or blocked, making it difficult for blood to be supplied to the heart. The blood vessels and nerves that control the heart and blood vessels may also get damaged and ultimately, heart failure. Other medical conditions such as HIV, kidney disease, asthma and thyroid disease can increase the risk of heart failure. One way to prevent heart failure is to treat and control the conditions that can cause it. There is a saying that prevention is better than cure. It's best to prevent the occurrence of heart failure by limiting and avoiding foods and habits that may affect your health and opting for a healthier lifestyle. Try these. Eat healthy foods. Eating a healthy diet is an effective way to avoid heart disease. Opt for more healthy foods like whole foods, fruits and vegetables that are high in fiber, minerals and vitamins, low-fat dairy products, whole grains, lean proteins and healthy fats like avocados, nuts and seeds. Limit the intake of sodium, added sugars, red meat, processed and fatty foods which are risk factors of heart disease. Staying hydrated also plays an important role in avoiding heart disease. Drinking enough water helps to lower blood pressure and reduce blood sugar levels as maintaining a healthy blood volume, making it easier for the heart to do its job. Maintain a healthy weight. Being obese or overweight puts pressure on the heart. Maintaining a healthy weight helps limit blood pressure, reduce cholesterol levels, and improve overall cardiovascular health. A healthy approach is to focus on nutrient-dense foods and physical activities that will help burn body fats and reduce cholesterol levels. Opt for a healthy lifestyle. It's recommended to avoid the habit of smoking. Avoid the intake of tobacco, cocaine or alcoholic products in order to prevent heart diseases. Get plenty of exercise. Regular exercise helps reduce and manage stress. Also, get enough rest when you are tired so you do not put pressure on your heart. And finally, take medicines as directed. It's recommended to take your medication to help you recover as quick as possible. Early detection and management of heart failure can significantly improve your quality of life and overall health. Thanks for watching. Don't forget to like, share, and subscribe for more health and wellness tips.